Hey lovers, it's Katrina. So some of you know I did a video a few months back talking about pelvic floor physical therapy, and more specifically I recently learned that I actually have some pelvic floor dysfunction. I was told that I had dyssynergia. I've learned since then that I probably actually don't. Dyssynergia is like when the muscles aren't coordinated properly. I think that was actually just some nervousness on my part. It was a rather emotional day. I'm seeing a new physical therapist now that I've had my procedure to correct my pelvic congestion syndrome, which is varicose veins inside the pelvis that was putting pressure on my ovaries. Super fun. Super not fun. Now that that's been taken care of, I'm looking forward to rebuilding my core strength safely. And while I was doing my initial appointment with my new therapist, we found a few other things that are going on with my pelvis. And I will admit that yesterday was emotional. I had some big feels. I may have had a big, ugly, angry, sad cry. I did. I found out that I have a cystocele and a rectocele. So what does that mean? Most people, when they think of prolapse or organ prolapse, they think of just uterine prolapse, when the uterus starts to fall into the vaginal canal. But there are actually other kinds of pelvic organ prolapse that you can have as well. You can have an enterocele, which is when the intestines kind of start to fall into the lower pelvic cavity and put pressure on the vaginal canal. You can have a cystocele, which is one of the things I have, where the bladder kind of dips down and puts pressure and kind of creates a bulge in the anterior wall of the vaginal canal. Or you can have a rectocele, which I also have, which is when the rectum starts to kind of fall into that pelvic space and creates a bulge in the posterior wall or the back wall of the vaginal canal. And both can create a lot of pain, a lot of tension. If you have a cystocele, you can get a lot of UTIs because it's more difficult to fully empty your bladder. It also can just give you pain that is similar to a UTI. So even if you're not actually dealing with an infection, you still have similar pain, and it can cause pain during intercourse. With a rectocele, it can make bathroom time super not fun. Makes it just similar to cystocele, makes it difficult to fully evacuate, and can lead to a lot of straining, which of course can lead to hemorrhoids, which those of you that have followed some of my other pelvic health videos from earlier, we talked about that and my personal journey with that. I'm still trying to avoid that surgery if possible, so hopefully pelvic physical therapy will help with that. And right now they're both relatively mild, so I'm in a place where with physical therapy and exercise and some lifestyle changes, like really getting my chronic constipation problems under control, we can correct this without surgery or without me having to wear any internal support pieces like a pessary. But it does explain where a lot of the pain that I've had and some of the difficulties that I've been having for so long come from. And it's upsetting because the last several months I've had multiple pelvic exams. I've had multiple people all up in my junk, and apparently no one else noticed, or they noticed but didn't tell me. I know sometimes, depending on the doc, they may not be aware of these things. if, an ER doc may not be fully as well versed in gyno issues, or a gyno may miss things that a urogyno would catch, and so on. And so sometimes it's just that, but there's definitely some angry feelings, because sometimes conditions don't really get addressed, within our medical industry, the medical industrial complex here in the States. Sometimes, a lot of times, issues don't get addressed until they are severe. And this is kind of a question of, well, how do you keep them from getting so severe that you need surgery if you're not told when it's starting what's going on? So, I don't know. I'm super grateful for my physical therapist that she caught these things, and so we can start working on these things. But I maybe want to, come back around and bring this new information that I'm learning about myself as I continue to share my healing journey with you all, because I know there's plenty of you out there, particularly people with vulvas and vaginas, who are dealing with pain, whether you're dealing with pain during sex, pain after sex, just generalized chronic pelvic pain, severe dysmenorrhea, cramps, and endometriosis, what have you, that we deal with this pain, and often the doctors tell us, well, that's just the pain of being a woman. It doesn't have to hurt. Like, our existence shouldn't hurt. Having a uterus shouldn't hurt. Just because you have a vulva doesn't mean that you have to live with pain. So, as I continue to advocate for myself and work through my healing journey, I will share and encourage you to advocate for yourself as well, right? Through education, through learning your body, listening to your body, and speaking up and asking for what you need. So, so we're back on the journey. As we continue to move forward, I will continue to share, and thanks for riding with me. See ya.